So thousands of inmates across Southern California have been released from jails and prisons due to concerns over this coronavirus outbreak. Now, I recently spoke with Lenore Anderson from the group Californians for Safety and Justice about this decision. Let's start with what's happening right now. How many inmates are we talking about? And this all happened pretty quickly, right?
This is happening quick. California has about 122,000 people incarcerated in the state prison system, and by both halting admissions going into the prisons as well as releasing people who were close to their release date, we're going to see probably about a 10,000 person drop in a few weeks.
Wow, I mean, and that's alarming. When you hear that kind of number, you think about communities who are worried about the impact on them. So is this a good, bad idea to release these inmates from prison? CNN had an article about, I think it was a Florida man who was released and then rearrested on suspicion of second-degree murder. So there are those concerns.
Well, these actions that are being taken by the Newsom administration are incredibly important and a good thing. The incident in Florida that you're describing is absolutely horrific. But a couple of things that many members of the public don't always know. First is that a lot of people who are incarcerated in our prisons and jails are not a risk to public safety. This is a country that has been lengthening the amount of time people spend in prison for such a long time that it's really not aligned with what it takes to stop people from committing future crimes. So there's a lot of people who can be safely released, and it's urgent that we do that to reduce the risk of the spread. And the other important thing that a lot of people may not realize is that even before the COVID virus, we have not used risk to public safety as the primary determinant in terms of who goes in and who goes out of an incarceration facility.
It sounds like maybe this could even set a precedent after the pandemic is behind us.
This would be an important moment to turn it into change that has been really long overdue. We have an incarceration system that has grown exponentially over the last several decades, and that really hasn't helped us improve public safety. At this point, we have so much of our taxpayer dollars stuck in the prison system when communities could do better with a more balanced approach. We need greater investments into crime prevention, mental health treatment, drug abuse treatment, things that could actually stop the cycle of crime and stop the number of people going into the criminal justice system on the front end. That would not only be better for public safety, but we're also learning now it would be much better for public health.
What about the organizations then? If you're saying maybe this was a catalyst for the change that's needed, but those organizations that are there to help these inmates, they're going to be impacted greatly by this and taxed.
Absolutely. When we're talking about reentry, we're talking about people coming home from prison or jail. That's a crucial time to make sure we put people on a pathway to stability. For many decades, regardless of the COVID pandemic, people coming out of prison and jail have faced extraordinary barriers. There's actual legal prohibitions to eligibility for things like jobs and housing, the things that help people stabilize and stay out of the cycle of crime. It's time we lift those barriers, give people a chance to stabilize, and provide money to the organizations that have been making a difference. We're talking about grassroots organizations, nonprofits that can help people find housing and stability. They're going to need flexible support right now.
They're also going to need a lot more oversight. I mean, how is this going to work? Tracking devices, new court dates. What is that going to look like?
Well, if ever there were a time to kind of reconsider everything about how we do public safety, it's right now. We're going to need to really rethink who we're putting in incarceration facilities, how long we're putting people in there, and how much money we're spending on the back end, on the purely punitive part, the prison part, versus how much we're spending on the front end in communities. Right now, the more that we can reduce the number of people unnecessarily incarcerated, the more that we can invest in those public health approaches to crime on the front end in the community, and that'll save us a lot of money and improve public health.
All right, Stan, Leah, I'm sure we could talk about this for an hour, even longer than that. And things are going to keep changing, so we're going to check back in with you. Leah Anderson with the group Californians for Safety and Justice. Thanks again for the time.